Perhaps no single person has made as significant an impact on reducing homelessness in Houston over the last decade as their former three-term mayor, Annise Parker. Yeah, okay, so you have an ordinance actually preventing tents or any obstructions on the streets or sidewalks,
Correct.
obviously. Yeah. How did that come about?
That has been in place for many years. I was a council member, then city controller before I was mayor, so I was in office 18 years. And I know we tightened up the no obstruction of the sidewalk when I was council member. So it's been around a good 20 years.
Okay, and that kind of leads into the whole focus of the conversation I want to have with you, because 3 terms mayor, and yeah, obviously all roads seem to lead to you. Everybody we talk to, it's kind of back to your administrations. And so, and I think the recurring themes were of collaboration and leadership. And somehow the leadership was able to create this collaboration that over 100 agencies suddenly working together. So maybe you could just talk about, you just mentioned some of your background. What in your background, allowed you to hit the ground running like that and create that kind of collaboration?
I don't know if it was anything in my background, but it was very much my willingness to expend a lot of political capital on something that would make a difference. Political capital is to spend on big, hard things. But I also spent 20 years in the oil industry doing project economics, and it all ultimately comes down to the bottom line. And the way we deal with homelessness across the country is inefficient, ineffective, and largely a huge waste of resources. And so I wanted to try to find a better way.
And maybe just on the political capital side, you have not just a strong mayor form of government, but a kind of a unique strong mayor form of government in Houston. You had a lot of political capital.
Houston's the strongest strong mayor city in the United States. The mayor hires and fires, with council consent, the department directors, but every single city employee works for the mayor, and the mayor appoints, again with council confirmation, the heads of a lot of relevant agencies, the Houston Housing Authority, in addition to the housing department, the head of Metro, and so forth. So yes, a lot of power, but not the biggest challenges or the hardest problems to solve are the ones where no one entity or individual owns that problem. And while I had the lion's share of the authority in being able to move resources, I didn't have the whole of the problem under my control. And so there was a lot of coercing and collaboration that had to be.
So maybe we could just go back to that point. When I look at the numbers just roughly, I think Houston has about 1/10 the homeless population per capita that Spokane has right now. Well, we have some things in common. You were the comptroller. I was the CFO for 18 years. So that numbers orientation on a problem and that project analysis you did, I can relate to that. And so it's kind of a human problem, but it has a cost element. I think we share that analytic approach to it. But going back to where we are right now with Spokane, we just love to get some advice on how to begin this process. And obviously, you're the one that initiated that in Houston, and in the last 10 years, you've come a long, long way. So maybe just some advice on, as you came into this issue, what did you begin to do?
Probably the biggest thing was owning the problem and saying, this is going to be a major initiative of my administration, and I'm going to put all city resources that I have control over to bear on this problem. But we had some assets, I guess, in Houston. One is that we had slack in the housing market. We're one of the most affordable big cities in America, and at that time we had openings in apartments. We had a very robust network of agencies working on homelessness issues, and a history of, say, a sort of tough love I guess, in terms of dealing with the homeless. We've had for decades an ordinance that says you can't block the sidewalk, you can't pitch a tent, you can't sleep on a sidewalk. You come to Houston, you're going to see the homeless. They're under freeway overpasses, they're along our byways. Houston is defined by 8 small rivers that run west to east, and people will camp along those little rivers, but they are, off the sidewalk and generally allow commerce to continue, and we expect that. When I travel to other cities, I'm shocked that to see essentially permanent tent cities on sidewalks. I was in San Diego 2 weeks ago, and encampments, on the sidewalk, sort of encroaching into streets, and you could tell that they'd been there for weeks.
Right, we've got that.
Would not happen in Houston.
So that's back to that tough love a little bit, and you would stand behind that.
I absolutely would stand behind that. That sidewalks are for everyone. Cities are, you have to have the ability for everyone to get some enjoyment. If you're in a wheelchair and you're going down that street and there's a tent city in front of you, what do? If you're pushing a baby stroller, they don't have a higher right to access that sidewalk than every other citizen. We instituted, back up a little bit. It's nice when you can edit stuff.
Right?
But
yeah. And we do.
One of the I wasn't going to get to this, but one of the things that we did, we made a homeless feeding ordinance in the city of Houston. You can go online, and it'll probably pop up that Houston prohibits people from feeding the homeless, which is absolutely categorically untrue. But we had a problem in downtown where we had different churches that would come down, like 3 different churches on the same Sunday, and they'd be on opposite street corners feeding the same 30 people. And we said, if you want to have a feeding operation, and then there was spill through the neighborhood, if you want to have a feeding operation on your own property, go for it. You can do anything you want. But you're coming into downtown Houston and you're camping out and setting up your operation on private property, on someone's parking lot,
Right.
or on the steps of a building. That's not appropriate, and it's not an efficient system. Why don't we create an efficient system where if you just register with the city, and we can know then when you're going to come down and have a food service operation, it's better for the homeless people. They have a more consistent access to food. It's better for the city, and it's better for the property owners. You would have thought I was asking someone to sacrifice their firstborn, but we passed it, and the ordinance now says that you can't feed more than 5 people without a food service permit from the city of Houston. Not hard to get. You don't have to pay a lot of money or anything. You just have to register, again, to create a more efficient system so we can provide the services. And for the most part, food service operations are enabling. They don't solve the problem. And so we were always resetting on how do we solve the problem, not how do we make people more comfortable on the street, how do we get people off the street. That's the goal. And
So
everything you do
long-term outlook.
Yeah.
A little bit of tough love at the front end, but we hear a lot about housing first, which obviously is an extremely humanitarian.
We did housing
approach.
first. That's
Yeah.
Most definitely. So I had a unique set of circumstances happen that prompted me to say, okay, I'm going to tackle homelessness, and I had some tools.
What were
available.
those? Do you mind if unique circumstances?
Sure. The heads of the Houston Housing Authority, Harris County Housing Authority, Houston Housing Department, Harris County Housing Department, and the head of the Houston Health Department, and the Coalition for the Homeless all changed. So I had new people. So I didn't have anybody that was, this is the way we've always done it, and this is mine.
Right. A willingness to change.
A willingness to change, because they were new and they were willing to try different things. The other is that the federal government offered an initiative on housing homeless veterans. This was the Obama administration, and they had a major initiative on homeless veterans. And they issued a city challenge. Could you house 100 homeless veterans in 100 days? Right. I think only 3 American cities took up the challenge. We were one. We have a large veterans population.
I think a few more took it up, but I think maybe only 3 succeeded.
Oh, maybe that's it. But I had a Veterans Initiative retired officer on my staff. We said yes, this is the right thing to do, and it allowed us to test the waters. So the interesting thing was it was new money. It was VASH dollars for veterans housing. And the VA was at the table for the first time. And a significant portion of the homeless are still Vietnam-era vets.
Right.
So we said, okay, we'll house 100 homeless veterans in 100 days. And it gave me an excuse to convene all the various agencies. And I wasn't saying to them, oh, you're doing a terrible job. I was saying to them, here's an opportunity to show your patriotism, and we'll all work together to do the right thing for veterans. So we had dozens of agencies around the table, and I could say, put your cards on the table. Let's see, what can you do? What can you do? What can you do? Everybody coming together, kumbaya, hold hands.
Yeah, that's a good moment.
And we housed 101 homeless veterans in 100 days. And then we said, okay, let's do it again. And by the time you do it 3 times...
You did it 3 times.
We did it 3 times. By the time you do it 3 times, you have a new paradigm.
Right.
But it gave me the opportunity to really see the various agencies in action, which ones could step up, what their resources were. Mm-hmm. And while some of the chronic homeless were veterans, these were also underhoused, they're in transitionally housed veterans. So, veterans are a unique population, but it gave me a landscape. Then HUD helped us out with doing a charrette here in Houston, where again brought all of the agencies together, and
this is following you were on a not good list with HUD.
Correct.
That kind of provided an impetus that you're talking about now.
Right.
Okay.
To do a charrette and bring all the agencies together with the Coalition for Supportive Housing, and take kind of what we had learned, and also bring in a broader group of folks to really talk about homelessness. And we had Coalition for the Homeless here, which is the agency or the association of various groups that deal with homeless.
And did you create that, or was that
it was already in place?
Uh-huh.
And what I realized was that we had a lot of great organizations, but they're all operating in parallel. Mm-hmm. And they all had their own little niche that they wanted to stay in. But if you're always moving in parallel, you're not converging on the problem. And they didn't... The resources that were available through these organizations were not the resources that we needed. So we wanted to prove it. So the next thing we did is that we went out and we did the point in time count,
right.
But we actually went and did individual interviews over the course of a week with as many chronically homeless people as we could find across the city of Houston. We had more than 850 individual interviews. I did some of the interviews myself. And we had a really good look at what the population was like. And then so I took that information.
You're gathering all this data.
All this data, real hard data.
I'm just pausing there. How did you get everybody on the same data platform? Because data is one of those
That's the next step.
things.
We weren't there yet.
We weren't there. Okay. Let's.
You're jumping ahead. And so we found out a lot about the population that we had and what they needed. Then we went and looked at the agencies, and we asked them for what is your target population, how many beds do you have, what are the resources that you have available, and some of them were like, I don't have to tell you. And this is where, if you want to make an omelet, you have to break eggs. And I said that if you're privately funded, I can't do anything about that. But if you get government dollars in any way, you will cooperate, because I will make sure that you don't get any more government
dollars. Back to that leadership. You just have to do that.
You did, I had to make people unhappy. And then I looked at the the coordinating council was all agencies that received funding, or they were representatives of the homeless communities. There weren't any independent voices on the Coalition for the Homeless. So I created sort of an Uber group of interesting, powerful community entities. So I had Cardinal DiNardo, who's the cardinal for the Archdiocese of Houston. I had Ann Stern from the Houston Endowment, which is our largest foundation here in Houston. I had the president of the Houston Astros, because they're right in the middle of downtown. So I had folks that they're not competing for little scraps of dollars.
Yeah, these were people with the big picture in
With
mind.
the big-
They weren't defending some particular turf.
With the big picture, and I made myself accountable to them, and so every other month I'd go before them, and we basically created a cadence of accountability. This is what we're doing. So
This is like an advisory group to the mayor, then.
Advisory group to the mayor, but they also had access to tremendous resources. Bob Urey was on that was on the group. They had access to tremendous resources. I mean, the Houston Endowment gives tens of millions of dollars to agencies across Houston every year. The Archdiocese operated one of the largest food service like outreach soup kitchens in downtown. So they were
similar in Spokane.
Yeah, they weren't they weren't direct recipients of the dollars, but they were aware of had the big picture, and you couldn't. And then we said, and then I could directly order certain things, and so I appointed the head of the Houston Housing Authority. They had 1,000 Section 8 vouchers unused, and I said, give them over. Now, again, the chronically homeless can't take advantage generally of a Section 8 voucher because they need permanent wraparound social services. But I had a lot of other transitionally homeless folks who we could immediately put in. Again, unpopular decision because we had a huge backlog of folks who, I don't know why they were sitting on 1,000 of them, just in case, apparently. But again, I had my new director, and we said, all right, we're, underhoused folks, we need to be concerned about, but homeless folks are a higher priority. So we started moving people, with those Section 8 vouchers. We, it was an 1115 Medicaid waiver. We got 1115 Medicaid waiver, and we applied as housing as healthcare, and combined that with other dollars to again spread the housing, but with the wraparound social services. Houston's a pretty easy city to, we're the queen of sprawl down here, and we're probably one of the fastest permitting cities in America, big cities.
Gets back to the zoning, and
we're not zoned. And
do you think that's related to the cost of housing?
Yes, because we're more market sensitive. You don't have artificial supports of you don't artificially limit the market.
So you don't have the big ups because of limitations on supply, but probably when you hit the lows, like say 2008, what happened in Houston in 2008 with the market crash?
We had a little bit of a downturn. I mean, yes, we probably had less than any other big city, again, because our housing market is closer to, there wasn't a bubble.
Right.
There was something of a collapse in the market, but there wasn't a bubble, so there wasn't a huge drop. So that's a benefit. We used 1115 waivers to create some telemedicine program. One of the things I discovered when we did our research was we were spending more than $100 million a year on the chronically homeless in downtown Houston. 10% getting 50% of the services. The vast majority of that money was going to emergency care. I'm still involved with something called Patient Care Intervention Council, which is a software system that you place in emergency rooms. The emergency room docs treat them and release, treat them and release.
Over and again.
And over and again, and because, they're too busy to do anything. But this is a way to capture frequent flyers in the emergency room and then connect them to the network of case management
it all
services.
gets pretty wonky, but from the leadership question, you almost have to. And you had to reorganize your own leadership within City Hall, more or less, around this.
I also hired two people, Mandy Chapman Simple from the Coalition for Supportive Housing. She actually was still on their payroll, but I paid her salary. And then Mark Eichenbaum as her assistant, so that I had, Mandy, one person whose eyes were on the problem.
Reporting to you, but not in the city bureaucracy either.
Correct. Reporting to me, but not in the city bureaucracy. And again, not worried about, if I piss somebody off, am I going to lose my, my job or my seniority in the system? She was working for someone else, but seconded to the city. The key element for what really began to move us forward was getting everybody on the same intake system, because everybody had their own little proprietary system, and we'd lose people.
Right.
Someone would go to one agency and apply for housing or whatever, medical care, and then they'd wander off and they go to the next agency, and the agencies didn't talk.
You might have them on a track doing this or trying to get them towards housing, and suddenly they're just off the grid on some other information platform. We saw that
they were in multiple databases, but the databases weren't talking, and so everybody now has to feed information into the same.
So we've got the HMIS at the city and a lot of the organizations in the city, but a lot of it, you really focused on everybody being on that same platform. We saw that at the Beacon yesterday. There's a long line of people coming in for breakfast, and they're signing in and they're collecting data and obviously then sharing it with everybody.
So one of the hardest things was when we took all the information we got from our chronically homeless, from our interviews, we we're starting to provide the services, and when I say we had these 70 plus agencies that were dealing directly with the homeless services, and we said, give us an inventory of how many beds you have per night and how many are vacant, and how you fill them. And we had hundreds of beds every night that were vacant because they didn't match the population. Nobody wants to house men with mental health issues.
Right.
There's homeless women and
veterans
kids and veterans, and they all deserve care. But this big bolus of our population didn't fit.
So you have all these empty beds over here, people sleeping on the street over here. And
right. And again, this is where you have to be kind of willing to be unpopular and say, again, if you have funding for that and you're comfortable with that, that's fine. It's not what I need. I am going to move federal and not a lot of city dollars in this because we're a low tax, low service state, and not much of a safety net. But I'm going to move any dollars that I have that are coming through the city to fill the need, not to support what we've been traditionally supporting.
And I just want to pause on that. I think people believe that we can't afford to deal with this issue, and some of the other cities, maybe Spokane, but there's this huge cost you just alluded to of not just doing what we're doing now. It's not like it's not costing us. What did you say, 100 million?
Just 100 million. We were spending 100 million on 10,000 people. 100 million a year on 10,000 people. I can put them up in the
and not improving anything.
Yeah. And the biggest part of that cost is in emergency room care. Just it's
right. So to move towards, obviously, Houston is leading the nation, lowest per capita homeless population of any major city. So you've had this tremendous move, I think, over 50% last 10 years. But back to the affordability, you didn't go and say raise taxes. You just said that's not how you dealt with it. That's not.
No. Now we did put we went to the voters and got the homeless bond funds so that we could begin to build housing.
Yep.
But I think part of the problem is that there's folks out there, we want to end homelessness. You are not going to end homelessness. People are going to fall in and out of homelessness. You can manage homelessness, and we can manage it more effectively. And you have to go in with the idea that there are certain people, that, particularly the chronically homeless, huge percent have substance abuse issues and mental health issues, and often both. That's going to require, probably for the rest of their lives, wraparound social services, permanent supportive housing.
So when we talk about housing first, and we've been talking about maybe relabeling it in our community, housing with help, because I think there's this misperception that people are being dropped into housing and we're done, but that's not the case at all.
There are, you know, people.
Real quick, we go back. You had a really good point about, because the capital costs for building housing and then providing those supportive services.
And the bond issue?
Yeah, and I want to keep circling back to that because we're such a small city. We only get one tax credit, 9% project every year.
Right.
And
Ben was the city council president for 8 years.
and so we're having a real hard time with capital on building enough housing in order to get people in.
And our housing costs have gone up 60% in the last
So
2
if you
years.
guys can just explore how you,
Right there.
like you
Yeah.
went from this is our strategy to building housing, and I think the number I've heard is 24,000 people housed over the last 12 years, and 7,000 units, which is
Well, let me just begin with that question
Yeah.
and ask how.
Okay.
Gavin,
Yeah.
just
Okay.
to clarify, just make sure you're not peeking into this camera. I don't think you are, but once
I
in a
did it
while-
once,
Yeah,
yeah.
gotcha. It's on you,
I saw
man.
Ben move and I. Right.
But yeah, I like the starting with the contrast of we're kind of the opposite. Like everything was pretty good the last 5 years. Tell them where we started the last 5 years.
With the housing costs.
Yeah, just
Yeah.
housing costs and we're seeing we're not seeing the population we never saw before. 5 years
Right,
ago.
right. So Spokane's direction right now is kind of problematic because we've had housing costs go up over 60% in the last 2 years.
Ooh.
And then we've also had this increase in our homeless population. So those are, when they talk about housing first or getting people into homes, that's a real challenge. But how did you go about it here in Houston?
Well, again, I had at the beginning 1,000 Section 8 vouchers,
Right.
and people who had jobs and lost jobs, or had families that got evicted. You can put them, if you have the spaces, you can put them back into housing. But the chronically homeless that have been on the streets for years, they have a complex of problems, and they have to be dealt with long term, and you have to go in with that.
So they're
it takes
being
longer
housed,
to get
but a
there.
lot of services.
They
Or is
are
it
being
even-
they're being housed, but a lot of services, and so you
Uh-huh.
have to be creating low income housing or affordable housing for the people who can live on their own, rapid rehousing.
Right.
Plus, you have to be on another track creating the permanent supportive housing for the folks who have the issues.
So it's back to the data. You know the differences in those populations
Right.
because of the information.
And we
you
have
collect.
a number of single room occupancy, the SRO facilities, or people who are coming off the street, and they're basically you get a little tiny efficiency with a twin bed and your own little space, but an intense case management operation, and you could graduate from there to something else. But you have to be doing all of these sort of simultaneously.
Right.
So we launched in Texas, low tax, low service state. We don't get funding from the state. It surprises a lot of folks when I say that in other
Yeah.
cities whose significant portion of their budget comes from the state. We don't get money from the state. We get federal housing dollars. We get a range of federal dollars. We don't get state dollars. And in order to put housing on the ground, we had to go to the voters and look at our bonding capacity and devote a certain amount of our bonding capacity to
And those are
housing
60% votes? So you need 60% to pass, or just simple majority?
majority.
And how did those go? I mean, were they well
we
supported?
haven't lost a bond election in a very long time, but it didn't require raising taxes. We did not raise taxes to do any of this. We
The
just spent the
community
money better.
understood. Somehow you made the case. People understood, or was that?
I haven't always been able to go to the voters and make the case. Sometimes they voted against me, but in this instance, absolutely, because again, we had we could say, look at what we did with veterans.
Mm-hmm.
300 homeless veterans, and we actually kept the system in place long after we did the first tranche and the second tranche and the third tranche. And
so you learned these things, and you had a system, and you also learned from your natural disasters, right?
But
I mean,
you have to
you
keep
had
talking about
Katrina
it.
and Harvey. You had to house a lot of people in short order there too. Did you
No,
learn from-
Harvey was
different?
We have very strict term limits. I'm banned for life from going back into city government, and we had 3 2-year terms. So I was in front of the voters all the time. So you have to be really good at communicating to the voters.
Yeah.
I placed an item on our city charter election. The current mayor had 2 4-year terms, so we had a little more runway. And he has kept a lot of the initiatives going. I think not quite as much personal attention, and I think the personal attention really makes the difference. But he also had a big setback with Harvey, which wiped out a big chunk of affordable and low-income housing stock. Apartment complexes that just went underwater and they had to be demolished. So that was a setback because you have to house those folks who are in those apartments. I know I was working for a local nonprofit, Baker Ripley. At the time, I was there for about 18 months. And when Harvey came, and Baker Ripley was given the task of running the evacuation shelter at NRG Stadium. So I was the daytime shelter manager, with my counterpart at Baker Ripley was the nighttime shelter manager. Overlapping 18-hour shifts at Baker Ripley. And as we were triaging the folks who were coming in, the city and the county each set up a 10,000 person evacuation shelter after Harvey. So what happened? Most of the homeless are congregated in more toward downtown Houston. So they filled up the city's shelter. The county shelter where I was working is out where the Astrodome is, the county facility, and it's got a secure perimeter, and they're just, we had a certain amount of, folks in the shelter that were previously homeless, but not so much. And and it was funny wearing the county hat at that point and negotiating with the city folks, but a lot of the homeless advocacy groups swept in and said, this is our opportunity. We really need to house these homeless folks. And my position was, no, I'm going to, again, time out. We have a lot of new homeless who were in apartments who were doing fine, and we were arguing about this quite a bit. Like, no, I think we need to get those folks back into housing before they fall in to chronic homelessness. The challenge for us here, in addition to losing so much of the housing stock, was that we have 1 in 5 maybe undocumented. And you cannot spend any federal dollars on those who are undocumented.
That's not a challenge we have. Okay, wow. Yeah. What an impediment.
It is an impediment. Now I will say that if you're here, there's very few people on the streets, they're chronically homeless who are undocumented. They're here to work. They're here to remit back to their home countries. They're hustling, but they were put on the street too. And so there's a lot of back and forth. And again, I wasn't the mayor or the county judge at that point, so I couldn't. I was a voice, but I couldn't.
But you had that perspective. I mean, you've hit on something that we have, and of course, the city-county relationship. Most of the homelessness is downtown, but it's obviously a lot of the funding and other mechanisms are there at the county. How did you bring those two organizations together?
New director of the county housing department and new director of the county housing authority. The housing authorities are the federally funded agencies, and then the city and county departments. And I had a good working relationship with the county judge, and we convinced them. It used to be that the county would spend money on the unincorporated parts of the county, and the city would spend in the city. And then for the first time, the county actually put county dollars. I mean, city taxpayers pay county taxes too. They put county dollars.
They saw that benefit.
They saw the benefit.
But that came through a lot of collaborative efforts.
A lot of
on your
collaborative
part
efforts,
others. Yeah.
recognizing that again, if we were going to solve the problem, we all had to come to the table.
And Mayor, as you look forward, because you've touched on a couple things that are affecting us right now, the higher cost of housing, and it sounds like one of the things that you mentioned earlier benefited you is you had the lower cost of housing, but that's changing here. And it sounds like you suddenly have housing going up quite a bit, and then you had the disasters pulling out your inventory. So that's an issue for us. Do you have any thoughts or ideas about how Spokane can approach getting people into housing, even with those higher, home values?
We also have really mediocre mass transit. And we are there's 640 square miles of actual city of Houston. So we're a dispersed city. There are at least 5 commercial hubs, including
That's huge.
downtown Houston. And so trying to, where do you provide the services? And I know I've seen some other cities where, well, let's build a complex where people can come and they can pitch their tents, and we can have basically like a homeless city. And again, that's not been our mindset. Our mindset has been, let's find the homeless where they are. And again, the agencies are across the city. If we can align the services the agencies provide with the homeless in their vicinity, let's go that way instead of trying to concentrate the homeless in one place. It is absolutely a problem.
It's a dispersed housing model then.
It's a dispersed housing model. We do. We get tax credit. We do tax credit projects. We put city bond funds in. We've put philanthropic dollars in.
It's just using every single tool you've got to get that housing.
And to try to, but not, we don't want to put them all in one place. We want to, one of the most fun things that I did as mayor, and it actually came to me from my mayor pro tem, Ed Gonzalez, who I hope becomes the ICE director soon. He's the sheriff of Harris County now. But he came to me with, we created a sobering center. City of Houston operated the city jail. We were the last city jail in Texas. And we were arresting some 19,000 people, or 19,000 arrests a year for people with public intoxication, most of them homeless. So we created the Houston Center for Sobriety, where a police officer could, if he picked up somebody who was passed out on the sidewalk, they could go to the Center for Sobriety, drop them off. You have to stay, I think it's a minimum of 4 hours, maybe 6, or until you are sober and able to manage yourself. But you don't have a criminal record. You don't go to jail. It's a 15-minute process instead of a 2-hour process.
So there's a role for enforcement in these situations, but it's not the typical enforcement.
It's not punitive necessarily.
It's not, right.
We also, the police department has a homeless outreach team. They get to know the homeless folks in their beats. We have a critical response team that goes out with the police for mental health issues. But having a range of enforcement mechanisms help. I like in the Center for Sobriety to, the old Andy Griffith show where Otis the town drunk, when he got really drunk, he'd go to the jail and let himself in. It's sort of that attitude. You could walk out, and for the first 6 months or so, it's just you come, you sober up. It's a pallet on the floor, and there's somebody there to watch you to make sure you don't die while you're there. Pass
so
on
meeting
vomit.
Them, you're meeting them where they are. But moving them
out of they're off the street. They're to where somebody can watch them. They're safe. They're not in our criminal justice system.
Right.
But then you have to, when you see who the frequent flyers are, and there were a couple of folks who were there, like twice a week.
Right.
That's when you have to be willing to step up and say, okay, you're a danger to yourself and others. We're gonna, you've got to go into treatment. You've got to, and so then the other side of this is they have to have the beds to do that. And as I recall, we had something like 10 beds for detox. in a city of 2.3 million people, in a county of 6.4 million people. Like
Right.
Tindy talks about, really? Again, a mismatch between what the services were and what we needed. But the Houston Center for Sobriety has been a huge success. I mean, it made the law enforcement agencies more willing to intervene because they knew they didn't have to drag them. They're not dragging somebody to jail. They're actually
Right.
taking somebody someplace where they could have help. Because we had done the work with the veterans, we knew which agencies were more efficient at some of these things. And as we went through the process, we learned who could step up and who was just really not. I mean, there's a lot of really great organizations that care deeply about homeless people, but they're just not very efficient service providers.
Right.
So and we had to be ruthless
Yeah.
about that because the money's there, but it has to go where it's
Well,
needed.
Tao even discussed how they altered their services at Search dramatically, kind of in response to what you're saying, the overlap and making
Yeah.
sure they were doing what they did well, but didn't try to do other things they weren't doing so well. And she said almost everybody had to do that.
Mm-hmm.
Yeah. I want to pause just a little on the business. You mentioned the leadership you had on your advisory group, but in general, talking to Bob Urey and the downtown group, it sounds like you had a pretty great relationship and a lot of support from the business community for these initiatives.
There was a lot of support from the business community for the initiatives, but there was also a lot of frustration on the part of downtown property owners, again,
Yeah.
where the concentration of the homeless is, and the desire for us, you need to do something. And
So they needed to see outcomes, and you
they
were
needed
able
to see outcomes,
Yeah.
and we were able to, by creating this sort of Uber committee, I had folks who held me accountable, folks who could move money to us too. There was a little method to the madness.
Yeah.
As they saw success, but they could also have the conversation with the business community that I couldn't. So they became advocates for the process that we were using, and that gained us a little bit of patience from the business community. And then as some of the corporate foundations began to step up and put more money into building more housing too.
Well, Mayor, I really appreciate you taking the time
Sure.
to give us this wisdom. We're hopefully maybe we can come back in 5 years and tell you how we did with it.
I would love that. Again, there's lots of money in the system. It just has to go to the right places, and then you have to squeeze the efficiencies out of it. And there's no silver bullet. There's no short-term solution. You can manage the problem. You cannot end homelessness.
It's a long-term commitment.
It's a long-term commitment.
Thank you.
Right.